Good morning. I'm on my way to work as usual, and I hope you guys are all doing okay. I'm doing just fine. So, I've mentioned before that I work for a very large radiation oncology practice. We have offices all throughout the United States and actually in some other countries too. Well, in my job, I review cases. I help our collections department write appeals to fight insurance denials for our patients' treatment. So I review a lot of, consults and things like that. And the other day, I was reviewing a case and I saw something that struck me and I wanted to talk about it. So, as you guys might know, cancer, can make you lose weight. It can cause you to lose weight, and that's actually one of the symptoms that alerts a doctor to look at a possible cancer diagnosis when a patient has a sudden loss of weight that's significant. Well, in this lady's consultation, the doctor actually mentioned that she lost 50 pounds because of ill-fitting dentures, and I thought, wow, that's a lot of weight. I don't recall how much she weighed in general, but 50 pounds, that's significant. All because, not because of her cancer, but because her dentures didn't fit. And I don't know what the exact issue is. I don't know what's going on, but I thought, wow, that's remarkable. So it made me think about, people that are new to getting dentures, or who have even had their dentures, like me. I'm in my 7th month, almost 8th month, coming up in a couple of days actually. As we go through the gum shrinkage process, our dentures don't fit right. So we have to take different, actions to help our dentures fit better, whether that be soft relines or, the semi-hard relines, at 6 months or whatever, or, doing the at-home reline kit, or like I do in my top denture is I use the secure adhesive for my top, and then I have a dentist soft liner in my bottom denture, and then I use a combination of paste and powder adhesive. So that's my method of making sure my dentures fit correctly so that I can eat, and I just wanted to, let people know that it's so important to make sure that your dentures fit, as good as they can for where you're at. Obviously, if you have the immediate dentures, they're not going to fit snug all the time because your gums are going through the shrinkage process. But like I was saying, there's different methods and measures that we can take to help them fit better. Now, I go to Affordable Dentures here in Fort Myers, Florida, and I got the new denture wear package. And what that entails is my immediate dentures, but it also gives me adjustments and relines and things like that I've already paid for. I don't know how much each service is a la carte, if you will, but I've already paid for it. So my point is that as I need them, I can get them. And then also, of course, my permanent dentures when I'm ready for those at the 1 year mark. But before I went to the dentist to get the their soft reline on the bottom, I was doing the at-home reline just for fear. I honestly had an issue with the office ruining my first set of immediates, and I just really didn't feel comfortable handing over my pert teeth to them. So I was doing things at home. But that just goes to show you that if you don't have the money or you're not able to get to the dentist, there may be some at-home things that you can try. So the moral of the story is, it is so important to make sure that your dentures fit as good as they can, given where you are. And I would say that the immediate dentures are probably the most challenging. Now, the lady that I'm thinking of, the patient, I don't know how long she's had her dentures. I don't know any of that. I just know the fact that, she lost the 50 pounds. Now, I I know that my sister-in-law, she she has a top denture only, but she doesn't wear it. And I asked her why, why doesn't she wear it? Because when my fiance told her that I was gonna be that I got dentures, she said, oh, she's not gonna be able to eat anything. And Ted's like, no, she's pretty good. She can eat whatever she wants, So my sister-in-law, doesn't wear her top denture because she came over for Thanksgiving and Christmas, and she's actually coming over tomorrow for her birthday. And so she's limited on the foods that she can eat. And, I found out that she was just in her immediate dentures and that they weren't fitting right and they were bothering her. And so she was like, screw it, I'm not doing it. So I'm trying to, coax her into going and getting, her permanent set, because she's already paid for it from Aspen. So, it's all ready for her. And her gums obviously have shrunk now, so she's able to get to the permanent. But that may be a reason for people not to wear their dentures too. I've heard of that, where the dentures hurt them. It rubs and different things like that. I only had a little bit of sore spots when I got my second set, the one I'm wearing now. The day I got it, I had a little sore spot, but I just took a little nail file and just filed it slightly, and I've been good. So I haven't experienced those really horrible sore spots that people have where, they can't even wear their dentures. I've never had that, but just, do what you can to make sure your dentures fit correctly. Talk to your dentist and see what you can do. So, well, I hope you guys have a great weekend coming up, and I will talk to you on the next one.